People are definitely getting excited to go out this summer due to lowered COVID-19 restrictions. And this includes people in their golden years who have been cooped up for a long time due to stay-at-home orders. If you fall under this age group, you should watch out for strenuous activities that could potentially injure you or fracture your bones. Today on the program, we'll talk about bone fractures and how to keep your bones healthy from injury. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. Our guests are here today to talk about preventing falls and related fractures. With us is Dr. Carmelo Braganza. He's an orthopedic surgeon at the De Los Santos Medical Center and St. Luke's Global City. Also with us is Dr. Krisha May Borromeo. She's a geriatrician from the Philippine College of Geriatric Medicine. Let's take a look at how important the skeleton or the skeletal system is to the body's central framework. Dr. Bragi, I'll start with you. How does this bones of ours, this skeleton of ours, give the body that ability to stand, to move, to be able to be mobile?
The skeletal system is the framework of the body. It provides attachment for our muscles and the ligaments. And it protects the vital structures like our brain and our heart and our lungs.
When it comes to aging bones or aging skeletal system, Dr. Krisha, can you talk something about that? At what age does our skeletal system change?
As one ages, our bone mass naturally ages as well, and it decreases. So for example, at age 50, women have a 50% to have fractures. And while men, on the other hand, at 50 years old, only have a lifetime risk of 20% to have fractures. So bone loss accelerates at age 50 for women. For men naman, it accelerates at age 65. Pero this acceleration continues throughout one's life.
Dr. Bragi, when it comes to that point in someone's life when they're 50 years old, what physiologically changes when it comes to the strength of our bones?
Become weaker at a particular age, 50 for the females, 65 for the males. But there are ways by which you can actually prevent the progression of this disease called osteoporosis, having brittle bones or a less dense bone. So things that can contribute to it are your estrogen deficiency for those who are menopausal. That's why it's more common in the females. Poor calcium intake and an inactive lifestyle.
Dr. Krisha, when it comes to that certain age, 50 years old and beyond, does that mean na kailangan mag-slow down ng isang tao if they were previously active?
Not necessarily, Freddy, So, ang ibig sabihin lang naman ng when you're exercising at a certain age, let's say at 50, 60, 70s even, or 80s, I've seen some people who are walking around the malls at 90-year-old only with a cane, So, those things or those activities are still very doable for as long as you are more prone to the trauma of aging and for simple falls. Because of osteoporosis, a simple fall may lead to a fracture if your bones are exceptionally brittle at that point. You just need to be more careful. So really, you do have to talk to your primary care physician or your doctor to check if your bones are at risk.
Dr. Bragi, let's talk about fractures of the bone. What are the more common ones? What should our viewers know?
The more common fractures are the ones that come from your trauma, from a fall or an accident. You may also get other types of fractures which are from overuse, those who exercise too much or move around too much with a poor diet. These are the stress fractures. You can get them in the feet. You also have your osteoporotic fractures, which are from the less dense bone.
Is there something significant where someone would know that they have a bone fracture as opposed, let's say, to a sprain?
It can be difficult sometimes to differentiate the two. That's why when in doubt or once you have an injury, like in an ankle sprain case, it's best that you just get x-rays to have it checked.
Dr. Krisha, when it comes to these risks at a certain age, is there any way to prevent this? What are some of the key factors that makes, like what you said, a 90-year-old being able to still walk around even with a cane as opposed to someone who's 55, who's barely able to be mobile?
For example, if you're a parent or you have a history that your mom or your dad had a fractured hip, or if you're currently smoking, if you've been taking steroids, if you have rheumatoid arthritis, or if you have a secondary osteoporosis, even as simple as a malabsorption, yung hindi ka maka-absorb proteins and other food properly in your gut can cause malnutrition. Especially yung mga tao na may chronic liver disease,
Will everyone at a certain age get osteoporosis? Is this inevitable?
So the osteoporosis as you grow older is not inevitable. So we usually gain our peak bone mass kasi in our third decade sa mga 20-year-old, 20 to 30s, ganyan. That's where we usually achieve our peak bone mass. So kung ano man yung dinala mo at that age, yun na yung kinakarga or yun na yung puhunan mo for the rest of your life. It's not mean to say that if you do not exercise at your 20s or your 30s, you are doomed to have osteoporosis. There are multiple factors that contribute to having weak or brittle bones. Very simple signs lang to know that maybe you might have had a fracture before is if, for example, people might shrink maybe a couple centimeters or an inch from their usual height, maybe kasi may compression fracture na yung vertebra, yung spine nila. That might be a subtle clue or indication for you to seek professional help.
A common question is this a lifetime condition? If I was diagnosed with osteoporosis, is that pretty much it for the rest of my life? Can this be treated? Can this be reversed?
Prevention is always important. So reaching that peak bone mass by your third decade of life is very important. But ways to counteract or treat osteoporosis is actually simple activity, a good diet, and calcium supplementation. In some instances that the osteoporosis is severe, then you can consider medication for that.
Coming up, we'll discuss the potential causes for the common bone fractures at a certain age and their complications. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. Another important part of our skeletal system is our joints, and they're made up of cartilage. They help connect your bones together, which helps in a person's movement. And as we grow older, though, the cartilage in our joints go through some wear and tear, causing the bones to painfully grind on each other. This condition is called osteoarthritis. Dr. Bragi, how common is osteoarthritis among older individuals, and how do we know if we have it?
It's very common, Freddie. You can see it a lot in our older patients who have deformities in their knee. The way they walk, sometimes they limp. So it's very evident, and it's one of the most common complaints that we have in our elderly patients. So one thing that can really help them is actually your exercise and increased activity levels, because when we activate the muscles around the joints, especially the knee joint, it can help prevent the discomfort they feel.
What are some of the factors that contribute to someone developing osteoarthritis? Is this preventable? Is this mostly genetic?
Porosis is the porosity or the density of the bones. Yung arthritis naman, joints yan sa kasukasuan. So pag pinag-uusapan na po natin yung kasukasuan or yung joints, the risk factors are age, like the osteoporosis. Age, usually in exponential increase na to at 50 years of age and older. So middle-aged adults kasi they're equally affected. After 55-year-old, we see more women in the clinics complaining of masakit yung balakang, masakit yung tuhod nila, ganyan. Aside from age, obesity, yung pagkataba ng isang tao, yung pagkalaki ng isang tao, talagang nakakadagdag ng strain. Aside from the pro-inflammatory markers ng obesity by itself can add to the problem of osteoarthritis. Genetic susceptibility is also one reason. Parang people are looking into genetic susceptibility that if your parents had osteoarthritis, are you prone to as well? So may genes po yan. Can be an inherited thing. And certain occupations, for example, are farmers. For example, are construction workers na akyat baba ng tuhod nila, akyat baba ng bewang nila. Yan, yung mga pro athletes who run miles and miles. Ayan po. So yung mga certain conditions or certain activities that we do or occupation that we do can predispose one to osteoarthritis.
Now, Dr. Bragi, for people who are diagnosed with osteoarthritis, are they also more prone to bone fractures as those with osteoporosis? How does this happen?
With osteoarthritis, this particular type of arthritis, it has some thickening of your bone in certain portions. So you're not actually prone to fractures because of the osteoarthritis, but I would say it's a risk factor because if you have pain in a particular joint, the thing that can happen is you have pain and you can get into an accident. You can trip, or since you're avoiding weight on that affected extremity, you can lose your balance and fall. So makes you more prone to falling.
At a certain age, with average activity level, not doing anything risky, what is the most common injuries in terms of fractures do we see in the older population?
So hip fractures, they're the ones who usually land in our ERs. Sila po yung nadadala sa ER kasi nadala si Lola, nag-slide po siya sa CR. Hip fractures account for a lot of the ER consults in the elderly. Sometimes kasi yung mga compression fractures ng vertebra, konting nag-shrink po lang kayo or medyo kumuba. Medyo silent compression fracture na po yun. Pero hip fractures, it's undoubtedly kasi hindi ka makalakad eh. Usually hip fractures, some people do have compression fractures of the spine, especially yung older people. Sometimes for fragility fractures or fractures na normally hindi mo dapat aasahan na magka-fracture, nahulog lang siya from a standing height, from a sitting height, from a lying down position. Tapos, bakit na-fracture na? Sabihin, clue yun, may osteoporosis ka na, bakit dapat hindi ka magkakabali ng buto, nabalian ka? So yung mga ganun po, fragility fractures are very, very important kasi that's a sign na may severe osteoporosis na po kayo.
Dr. Bragi, let's talk about that. Kapag na-fracture ang hip, what is the treatment option based on this?
It's a misnomer that you say it's a hip fracture, right? But it's actually that proximal end of the thigh bone which is broken. So the treatment will actually depend on the area of the fracture, if the patient will need a hip replacement, which we mostly do, or if it's amenable to a repair or fixing the fracture with plate and screws or a nail. So those are the treatment options for it. Now, if it's not too displaced, because that is possible to get a fracture in the hip that's not displaced, and sometimes maybe we don't even have to proceed with surgery. But I cannot overemphasize some of the things that Dr. Akrisha said a while ago regarding the complications associated with a hip fracture, because those are the things that can lead to increased morbidity and actually death. No? So you can get your bed sores, pneumonia. Our patients have altered sleep-wake cycles. They have lack of appetite, even depression. So that's why we want to address these hip fractures as soon as possible.
Dr. Bragi, what's the most important factor here in determining whether this patient with a hip fracture is eligible for surgery or not?
Yeah, as much as possible, your patient should be medically fit to undergo a procedure, right? So either way, if your patient proceeds with surgery or does not, then at least have some exercise for them while they are lying down. Because the reason you want to do the surgery for your patient is so they can be mobile and try to do the things that they used to do, even if it's just simply going around in the house. Because you have different patients, right, that they just stay in their house. You have your community ambulators. You even have patients who do marathons and run. So what we want to do with the surgery is actually bring them back to their pre-morbid level.
We'll discuss how to prevent injuries to your bones and how to keep them strong and healthy after a short break. Your care is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Now, let's discuss how to avoid bone injuries, especially those caused by falls. At what point should an older person consider using a cane to avoid falling? I'll ask this to Dr. Bragi.
You should consider using these walking assistive devices if they do have severe pain in their hip or their knee or even in their spine. These can all help. As long as your patient is having discomfort, then it is recommended that they use these walking assistive devices.
Is it practical if you have someone in the house who is geriatric age, senior age, to retrofit the house to be more accommodating to their needs and maybe to help prevent fractures?
So you have to look around and see ano bang pwedeng environmental factors, changes that we can do to prevent falls. So number one, we can see kung meron pong mga nakakalat, carpets. Maybe there are mga wires na nakakalat lang, pwedeng mahulog or matapilok yung pasyente or yung matanda natin. Yung mga pang-akyat po ng hakbang ng Kailangan ba niyang humakbang para makapasok po sa isang kwarto? Meron pong ramp ang harapan ng ating gate para hindi na kailangan umakyat or umakyat matataas na hagdanan. May railing, may banister ba? Especially sa CR, ang dami na po nating mga narinig na horror stories na okay, this day, pero dahil nadulas sa CR kanina, meron po tayong mga fractures na nai-incur.
Dr. Bragi, do you have any tips for us on how to prevent bone injuries in general?
One thing that can really help is actually just simple exercise, some simple exercises that can strengthen the legs and help maintain these patients' balance. So having all those railings around are actually very important as well, because as long as there's support in the house, then we lessen the chances of our elderly patients slipping or falling.
Let's talk about the mental state of those who are growing older. Are those who are older, senior citizen, are they more prone to depression for that matter because of their lack of mobility for one? Maybe because of a fracture or just maybe because of osteoarthritis?
It really affects someone. Na-isolate ka nga lang, we've heard so many healthcare workers na na-isolate nga sila sa bahay for 2 weeks because of COVID. Diba, minsan may depression, meron na po tayong mga ill feelings na kailangan po tayong makausap ng isang counselor. So in the same way that someone with a fracture that immobilizes them can really affect their mental health. Aside from the fact na if you're under chronic pain, sabihin natin the moment that you wake up you're in pain, till the time that you're sleeping you're in pain, sinong hindi malulungkot doon? So yung mga ganyan pong factors, yung pain, social support, mobility, rehab, early referral to a therapist or to rehab medicine para we can give them hope, or at least, the very least, we can modify their surroundings to make them more mobile and more independent. That's really the best.
Dr. Bragi, are there lifestyle changes with a person who is in their 20s and even 30s, as early as that? What can they do at that age to improve the state of their skeletal system when they become older?
We want to ensure that we do have good nutrition, eating a well-balanced diet, getting adequate sunlight exposure for our proper bone metabolism. And in that same manner, you get adequate recovery and rest. Don't stay up too late, don't smoke. Those are the things that can actually affect our bone metabolism in the long run.
Dr. Krisha, do you have any advice for our viewers, especially when it comes to aging?
So age, really, it doesn't really mean na once you hit a certain age, dahil senior citizen ka na, dahil may mga apo ka na, may grand apo ka na nga, doesn't mean that you have to stop moving. That doesn't mean that you have to stop exercising or eating well. No, you live your life. Don't make age an excuse. Maximize the best days and years of the sunset years of their life. No? So don't look at yourself na, okay, ganito na ako, hanggang ganito na lang ako forever. Really, the sky's the limit for you, no matter at what age you are.
And Dr. Bragi, any advice for the viewers?
My advice is just keep as active as possible, no matter what age. You can modify activity. You don't have to be running outside. You can use a treadmill. If you used to run and your knees hurt, then you can ride a bicycle. So there's always some level of activity that can be done.
Thank you very much, orthopedic surgeon Dr. Carmelo Braganza and geriatrician Dr. Krisha May Borromeo for being with us today and sharing your very insightful insights as well as your expertise on the topic. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.